Hey, it's Dr. D, surgeon with a gun. We're going to have another coronavirus video because everybody's still freaked out. And if you're in California, I'm going to show you some numbers right from Google, which tell you why you really shouldn't be freaked out about this thing. I mean, sure, it's a bad virus relative to the flu. It's probably 2.5 times worse than the flu, and I'll show you how I come to that. But we don't stop the world from turning for the flu, and we should stop the world from turning from this, or because of this. Let's take a look at some stuff on the computer. So here we're looking at the search results from Coronavirus Deaths California, and what you'll find in the upper right hand corner, and I know this is hard to read, but you can simply search it the way I did, is here we are, May 8th, 2020. The deaths from coronavirus in California are read out as 2,504. Population of the state of California is 39.51 million. And the stats for the state of California, and these are from the Centers of Disease Control and Prevention. This is straight from the CDC. It tells you that in 2017, the number of people in the year who died from influenza and pneumonia was about 6,340. So say roughly 500 and some change a month. So if you say the coronavirus thing has happened for the last 2+ months, then you've got about, in influenza and pneumonia deaths, you would have had about 1,000. So now, state of California, we have 2,504. So that's why I say, roughly speaking, and death is the only absolute thing you can talk about, even if these are deaths from coronavirus, which is another statistical problem with regards to the way we keep numbers. But even with that being said, in a population of 39.51 million, roughly 40 million, while the death of 2,500 people is not a good thing, it's not so many people that I think you can justify the degree to which our freedoms have been impacted. And many people, including the poor lady in Texas who was basically jailed for defying a judge's order to keep her hair salon closed, that doesn't seem warranted. And I'm speaking with the statistics for the state of California, but all of which you can confirm if you go online and check. But the hysteria that is surrounding this thing is greatly enhanced by the media coverage. Really, they're covering this thing like the Super Bowl. And relatively speaking, this is a public health problem, but it is not nearly the degree of public health problem that we were fearing back several months ago when the restrictions that we're currently living under were implemented. So I'm not saying don't follow any kind of protective stance, meaning wearing masks makes sense. I mean, if you want, look at my other coronavirus video, which is very, very basic with regards to wearing masks, social distancing, etc. But the main reason for this video is to combat what I see as really unreasonable hysteria on the part of people who believe this virus is going to come and kill them like some kind of zombie apocalypse movie. And it is nothing of the kind. Sure, it's a problem. People who are ill, particularly those with pulmonary or heart disease, have to be worried because this can potentially kill them. But the numbers of people dying are a few times more than die from the flu anyway. And like I said before, we don't close the state, close the country, close the world for that matter, because of it. And returning to some kind of function makes a whole lot of sense, particularly because a lot of people are economically hurting. The country in the whole is hurting in a big way. And some middle ground, meaning some reasonable process of returning to work, makes a whole lot of sense. All right, well, that's basically the shtick that I wanted to convey. The main thing being, protect yourself, take a reasonable stance, but don't be hysterical, because the vast majority of people don't need to be hysterical over this thing. Take care, everybody, and stay safe.